Hello and good morning, everyone. And today we are going to talk about growth and development. This is my second lecture for pediatrics. And in the first lecture, we talk about the introduction to pediatrics. Um, to start with, first of all, we will talk about growth. And in growth, there are a few things which I wanted to talk about. Is every child every child have his own way. Every child grow in his own way, or you can say differently. So we cannot compare one child from another child. For example, it's not like this that all the children will start walking. You can say at 1 year of age or 10 months of age. There are children or infants who started walking at 11 months of age. There are children who will start walking by 1 year of age, and there are children who will start walking by 14 months of age. Okay, so in short, like all the children, they have different way of development and different way of growth, and that's why what we do is um, we define some, not we, um, the medicine or the researchers, they have defined some red flags. Okay, so as soon as some child is not in that limit or have not crossed the time for that red flag, uh, like we don't treat them before that. I will discuss about that in a while. So one thing you to remember is like growth is not linear in children. Okay, growth is not linear, and just to tell you, the first 2 years of life, okay, of any child, and also at the time of puberty, the growth is really rapid. You can say, okay, they show rapid growth. So and also there is different times when different things are developing. For example, at the puberty, of course, like the gonads, or for example the ovaries and testes, they are the one, or the genitals are the one which will grow at the rapid stage. uh, like in the first 2 years of life, the system which grows a lot or which develops a lot is the central nervous system, and that's the reason they acquire many skills like speaking and walking and fine motor skills or gross motor skills or social skills. They acquire in the first 2 years of life, most of them. So as I told you in the previous lecture, that especially the first few years of life are completely connected with what you can say, with the events what happened during pregnancy. And there is a term which is called as premature, and then there is a term called as mature, or then there's a term called as post-mature. Okay, so normally the pregnancy is from 37 weeks to 42 weeks. So all the kids who are born from 37 weeks to 42 weeks, uh, between 37 weeks of completing the intrauterine life to 42 weeks, is considered as mature neonate. Okay, so for example, uh, premature infants, premature infants are those uh, who are born before 37 weeks of intrauterine life. Okay. Um, so what's the importance of this thing? Um, Especially any kid, any child who is born before 34 weeks of completing the intrauterine life, what happens at that time? Their lungs are not mature, and what they can have is like many respiratory problems or once they are born. And that's the reason like any woman who go into labor before 34 weeks of pregnancy, what the doctors do, they give them steroids, okay, two injection of steroids like 12 hours apart, just to make them their lungs mature. More details will be coming soon when we will discuss that topic. So especially the kids, who are less than 37 weeks of age, intrauterine life, we call them premature infants. And like usually until 2 years of age, whenever we examine the baby, whenever we look them for any medical issue, especially something which is related with the growth and development. So what we do, we basically correct their age. Okay. And that is done just like until 2 years of age. So we correct their age, okay, until 2 years of age. And after that, like, we don't care. So like, for example, if someone is born like 1 month before, so then you are going to look them according to that scenario. Okay. And when the babies are born, by the way, their body to head ratios are different as well. Like yeah, you can say the babies have quite a big, you can say, head, and as compared to the rest of the body. Okay. So but like their head size is bigger than the, like if we will take a ratio of an adult body to head ratio to a ratio with infant, the infant have quite big head as compared to the body. And also like they have a lot of differences with the adults, not just this one, of course. So what we are going to start now is how they grow. They grow normally. The birth weight, if we will talk about the birth weight, of course, like there is always a range. Okay. uh, like we call them as of course, all the babies, they are not born at the same weight, but some of the babies, when they are born, maybe you will find them at like 3 kilograms, some babies maybe 4 kilograms, some babies maybe 2.7 kilograms. But on an average, normally the babies have 3.25 kilogram of weight, but that is equal to 7 pounds. Okay. So depending on whatever uh, metric you want to follow. So, like this is the normal birth weight, like around this value is the normal birth weight. And a very important thing, once they are born, the babies, they lose a lot of weight, uh, around 10% of their body weight. 10% of the body weight they lose in they lose in first week of life. Okay. Because what happens is whatever they have extra, for example, in intrauterine life, their RBCs are quite higher than when they are born, because they are in comparatively hypoxic conditions when they are inside the mother. And once they started using their own lungs, so that they are getting too much oxygen, like good oxygen, so their RBC started breaking down. They lose a lot of body fluids as well. So 10% of the body weight they lose in the first week of life. You can see over here 3.25 kilograms, you can take 10% of that. So in the first week of life they're going to lose that. But after that, they started gaining the weight. So, like, of course, we must know these things, because uh, these are very important when you are checking any baby. Okay. So ideally speaking, for example, if you are examining a neonate at 15 days of life, or 20 days of life, or 30 days of life, so normally if the first week is gone, or you can say by 10th day of life, they started they started gaining the weight again. Okay, so this thing is important to remember. I will just tell you a few rules. Like, of course, we don't have charts everywhere, and you can examine the babies anytime, and you must have something in the mind. One thing, for example, the mothers, they do remember, especially the birth weight of the baby. And for example, in countries like China, when you will get the birth certificate of the baby, you will find that they write the birth weight of the baby just as a record. So that's very important. And they also write how many weeks pregnancy was there. So either the baby was premature or post mature. So, like countries like China, you cannot hide even this thing if the baby was premature or not. So, as a rule of thumb, you can say, remember these things that most of the babies uh, they they double their weight by 6 months of age. Okay, and they triple by 1 year of age. This is a very, very, very important point. Like usually, uh, like I saw many patients, by the way, and whenever like you have to see either the baby is gaining proper weight or not. We always ask, like, do you remember like when the baby was born, how much was the weight of the baby? So if the mother is saying like at the time of the birth the weight is 3 kilograms, and now the baby is like 1 year of age, so you can simply calculate, 3 multiplied by 3 is equal to 9. So the baby should be around 9. A baby who was at the birth like 4 kilograms of weight should be 12 kilograms by 1 year of age. Things go like this way, and they like their birth weight become 4 times at 2 years of age. So a 3 kilograms baby at birth should weigh 12 kilograms by 2 years of age. So, like, this is a very, very important rule, you can say, and very interesting rule as well. Uh, like, especially when you're working clinically, and of course, you don't have when the mothers they bring their babies, so they always bring the growth chart. I will show you in a while what is a growth chart. Talking about the length, like I really like this topic because this is quite interesting. So on birth, most of the babies they are 50 centimeter in size. If you will convert that in inches, it will be 20 inches. By the way, okay. So 20 inches, or you can say 50 centimeters in size. And again, there is a very interesting rule in this one as well. Simply, they increase in size. They gain 25 centimeter in first year. Okay, 12 centimeter in second year. Okay, and then 8 centimeter in third year. So quite easy. You will find like 1 year old baby around 75 centimeter, and you will find around the babies who are 2 years of age. You will find their height will be around 50 plus 25 plus 12. That makes 87 centimeters. Okay, so this is like uh, how they behave in length. Okay, so one very important thing to mention here is what most of the babies, um, when we check their length, okay, so we put them on the bed and then we measure them until they turn 2 years of age. And after 2 years of age, okay, you can measure their length just by making them stand. Okay, so the third thing is head circumference. And uh, head circumference. Okay, so when we measure the head circumference, it is 35 centimeters at the time of birth. Why this thing is important? Because we monitor that. Okay. And we plot that on growth chart as well. For example, a baby who have a condition, if you know about a condition called as hydrocephalus. What is that? Like in this one, the drainage of CSF is not proper. And what happens, by the way, um, like the babies, their sutures are not closed. Okay, their skull bones are not fused together, so their head can become bigger in size, and so we monitor that. Okay, so this is how like the thing goes, and the head doesn't grows at too much fast speed than the rest of the body. Okay, in the baby especially. So like these are the few things, we do measure whenever we examine any baby. Okay, and this is how generally the babies behave, so that's why like these are very important when you're working clinically especially. Okay, so this thing is like some few things which were important. And now whenever we examine the babies, okay, before that I can show you um, that what you can say, the growth chart. Okay, this is how growth chart looks like. I'm not sure like how clear it will be for you guys, but I can tell you what it is. Like this one is age in months. Okay, this is for girls, pink one, and blue one is for boys. This one, okay, more or less like all the countries, they have more or less the same growth chart. But guys, like things are different for different type of, you can say, races. For example, you can say the African race, or Caucasian race, or this Asian race. Of course, we don't have the similar sizes, or especially that developed as well as developing countries. For example, in developed countries, the babies when they are born, they are quite healthy. Their weight is good, but in many developing countries, the weight is not that much good. So every country has its own charts, but most of the charts, they come from the developed countries. And if you will see over here, this one is like the age in weeks or months. Okay, see, this one is like the small numbers you can see is the weeks, and the big one is months. Same thing for girls, you can see over here. Here, all the measurements are written. And see, here's the weight, here's the length, here is the head. And what we do, by the way, as I told you, we keep on asking them to come on different visits. So, for example, okay, and to understand this thing better, one thing which I don't know how many of you know about that, but statistics and epidemiology and biostatistics, we study something called as percentile. And in percentile, see, these are basically percentile lines. And this one is like the 50 percentile, like and this one is like the standard deviation, one standard deviation, second or third standard deviation. So these charts, they had made after many like researchers, you can say, and seeing like how the babies are, like how much is the average weight of the babies and things like this. So for example, a baby is coming to me at the time of birth, I will point here 3.5 kilograms at birth, or 50 centimeter length at birth, and the head circumference. And on each visit, you can say, I will keep on plotting the chart. Okay, so what you can say, like if a baby is coming to me, and um, just give me 1 second. I just want to take a pen, for example. I make a chart, I plot a chart, and I found that a baby is growing like this way. Like I'm plotting the chart, right, for you guys. So what I will found, the baby is going in this manner. Okay, so what we have to do, we have to like join all these lines, and what we can found is like see, it's a linear line. So what it means, like the baby is showing a very good growth because he's following this line. Okay, like I will give you one more example here. For example, if some baby weight at birth was like here, then he came at this time here, then he came at this time here, but then he came one day after a few months, then here, here, or here. Okay, so see, when we are going to join the lines, what we are going to found in this case is he was good, but now see the weight is declining. Okay, this condition, see, because his weight line is crossing one, two, three standard deviation lines. Okay, sorry, one and two standard deviation lines. So of course, we call this condition as failure F, failure to thrive. Okay, failure to thrive. This condition is called as failure to thrive. Of course, there is a lot causes of failure to thrive. For example, a baby who is not getting enough calories, a baby who is having some problem with you can say with some malabsorption things like celiac disease, a baby who is having some chronic condition like a heart condition, asthma, many other things. Okay, so what happens is like they are not thriving well, so we call it as failure to thrive. Okay, okay, I will give you one more example and then we will move forward. For example, a baby is coming to me, and remember, guys, short mother and father means short babies. If the mother father height is 5 feet and the mother height is 5 feet as well, so don't expect that their children will be 7 feet of height. And even if they will come to ask you, like, why my baby is shortest in the class. So what we do is, by the way, we calculate the mid parental height. Okay, there is a way to calculate the mid parental height both for the males and females, or girls or boys. Okay, so we calculate the mid paternal height, and we according to that we tell, okay, either their baby is normal or not. Okay, so of course, like if the mother is there is a baby in which like the mother and father is like both is 6 feet around, you can say, so of course their baby will be big. But if the mother and father both are of short height, so of course their baby will be short height as well. Okay, so see, for example, this one I draw. Of course, like this baby, when he was born, he was smaller than average babies, but see, he is following a linear type, or he is not crossing any standard deviation lines. On the other hand, I will give you one more example. For example, a baby who was born here, 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 here. Okay, like this way. So now by joining this lines, what you will found is this pattern is crossing some standard deviation lines. We call it as failure, failure to grow. So failure to thrive and failure to grow. Anyhow, these were just examples for you guys to explain. Okay, and I will move back to what you can say my general topic. Okay. Okay, just give me 1 second. Okay, so this one is like you can say uh, uh, okay. So now, guys, I don't know how to how to go back to the pen thing. Text. Um, wait. Okay. Okay, so what I wanted to talk about next is, as I told you, what is failure to thrive and failure to grow. Now we will discuss this thing when we will discuss the topic of failure to thrive and failure to grow. What are the causes of when someone is not gaining the weight properly, and what are the causes when someone is not gaining the height properly, and what are the how we approach those cases. Okay, so like the of course, like in a while, not in a while, but in my next lecture, we are going to discuss that then. So now, our next topic, which we will be covering, is mm, reflexes. Okay, reflexes. I am really not sure how to go back to my my pen. Huh. Wait. Okay. Okay. So reflexes. Now, because reflexes. Okay. Now, because what we are going to do now is the examination. I was talking about yesterday, how we examine the babies. Okay, but like yesterday, because I was talking generally introducing the pediatrics, but today I'm talking about the growth and development, and that is of course like I'm more focusing more on the from the newborn baby. So in reflexes, like we check the knee reflexes or bicep reflexes or tricep reflexes, just to see like if the CNS is working fine or not, right? Like they take a neurological hammer and they hit like some under your patella, and what happens is like your knee gives some jerk. Okay, so that is called as knee jerk. So that is just to check like all the circuit is functioning fine or not. So in the babies, because or infants especially, or the newborn especially, when they are born, we are not sure like either they have like normal neurological things are there or not. So what happens, we check some reflexes in the babies. For example, one of the very important reflexes called as moro moro reflex. Okay, so what is moro reflex? Moro reflex is what they do is uh, they they keep the baby, okay, in a semi upright position. Like of course, and you must be very gentle and careful and always explain to the mothers or like any caregiver who is there, because they are really concerned what you're doing. So while the baby's on the bed, we make them sit upright, okay, semi upright you can say, and we hold their head by our one hand, and we keep one more hand a little downwards, and we suddenly withdraw our head which is supporting their head, and or simply we let them withdraw or free fall a little. So once we do that, what the babies do is they uh, abduct their arms, okay, or they open their arms. So and after that, like once they open their arms while uh, falling, then they close their arms again. Okay, so this is like one of the reflex which we test in the babies. It is called as Moro's reflex. I can show you this reflex here by this way, that if we can found okay, well, yeah, but by the way, on YouTube when you will write Moro reflex, you will found a lot of videos how they check Moro reflex. Okay, and how they do this reflex. But this reflex is very very important, guys. Whenever we examine, okay, we always check for the Moro reflex, and a very important thing um, to check in the newborn baby especially. Okay, so motor, this is called as motor reflex. So simply they abduct and extend their arms. Okay, once you will let them free fall a little. Okay, of course, like you don't let them fall, but hold them back again by your other hand, which is free. Okay, like of course, when you will see the video, you would have an idea what I'm saying about, talking about. So this is called as motor reflex. Then there is what you can say one more reflex called as grasp reflex. So what you do, like the infants, if you will put your finger inside their palm, okay, if you will touch their palm, so what they do, they basically they try to grab your finger, okay, that is called as grasp reflex. Grasp reflex, okay. So simply when you touch or place your finger on their palm, they flex their fingers like they are grabbing your finger, okay, that is called as grasp reflex. And then there is placing reflex. Placing. So what is this one? uh, for example, if you will hold a baby so that their feet is at the level of the side of the table, and you will touch their feet at the side of the table, what they do, like they will try to step on the table. Okay, so that is called as the placing reflex. And then there is a rooting reflex, very commonly done, and most of the pediatricians they do this thing on a newborn baby. Simply touch any side of their mouth, and what they will do, they are going to move their head towards your finger. Okay, why? Like simply, like when we are going to feed any baby with the bottle, uh, you will touch the nipple of the bottle on the side of their mouth. They will move their mouth towards the bottle just to like take that thing in their mouth, and they will start sucking as well. And at the same time, you can check one more reflex called a sucking reflex. For example, not done mostly because we don't want to put anything dirty in the baby's mouth. But if you will put your finger in the baby's mouth, what they will do, they will start sucking that. Or if you will put their bottle in their mouth, what they will do is they are going to start sucking that. Okay, so that is called a sucking reflex. And of course, like all these reflexes are present in the newborn babies, and they are very important, by the way. Okay, so there is like other reflexes as well. Gallant reflexes there, and there is parachute reflexes there. Parachute reflex. Parachute reflex is also there. Okay, so what is gallant reflex? uh, if you are going to stroke the back of the baby, okay, if you are going to stroke the back of the baby a little lateral to the midline, okay, so their pelvis will move in that direction. Of course, you can see it on YouTube for the better idea. And parachute is simply you are going to what you can say, when the baby is going to is in the sitting position, okay, so you will tilt the baby to one side, okay, so what they will do, they're going to extend that arm. Okay, so this reflex is not present at the birth. All these reflexes are present at the birth, but this reflex is present around, you can say, a little after birth, like 6 to 8 months of life. Okay, one of the things which I will tell you, all these reflexes are also called as primitive reflexes, because they are present when the babies are born. Okay, and if, for example, the moro is absent, or grasp is absent, or placing is absent, or any of these reflexes absent, it means like simply remember this thing. If any of these reflexes are absent, what it means, like there is some CNS abnormality. Okay, so what we do, we always check these reflexes just to make sure like everything is working fine. Okay, and guys, these reflexes are present at birth. Okay, and if they are not present, or if they are abnormal, it means like they have some CNS abnormality. But on the same, like this point is very important. I'm stressing it again and again, that if they are absent at birth, it means that there is some CNS abnormality, and they are called as primitive reflexes because they are present at birth. Okay, and one more thing, when the babies they started growing, these reflexes should go away. Okay, and if the reflexes are not going away, for example, at 6 months, okay, at 6 months of age, if they persist, if they're still there, which means again that there is some CNS abnormality, for example, cerebral palsy. Okay, like of course, maybe you are not familiar with these terms, but like later on when we will discuss more and more, um, we are going to discuss them. One very important, interesting point which I always ask in MCQs, and um, like Many people, they answer it wrong. Like there is something called as Babinski sign. Babinski sign is what is that? Like, in adults, like whenever someone has stroke, or in neurology, what we do, we stroke the bottom of the feet with a sharp object. And what happened, the toes, they curl downward. Okay. Now, again, you will write Babinski sign. Sorry, this S is extra. Babinski keys, not, it's Babinski sign. Okay. When you will see that on YouTube. Okay. So the toes should be down going. Okay. So we call it as the planters are down going, which is normal. Okay. And if, for example, if someone has stroke or any upper motor neuron type of lesion, whenever we stroke their bottom of the feet by a sharp object, what happens if their toes are going upwards or the planters are going upward? It means like that is abnormal. Okay, so guys, one thing about pediatrics, remember this: if you are going to try Babinski sign in babies, they have upgoing planters, upgoing plantar reflex. Okay, which if we will do this thing, and adult will show this thing, it is abnormal. But in babies, until 2 years of age, when you will try Babinski sign, they have upgoing plantars. Okay, so it is normal, it is not abnormal. In adults, if the plantars are upgoing after Babinski sign, that is abnormal. But in babies, up to 2 years of age, okay, planters are upgoing, that's completely normal. So these things are basically all the things we do to check like how is the CNS of the baby, or the central nervous system, neurological system, is fine or not. Okay, so all these things we check in the baby. So the third point which I want to discuss is development. Okay, uh, see, reflexes are done at the time of birth. Okay, just to see if the CNS is working fine. And as I told you, that if the primitive reflexes will be there for all the life, or the sick after 6 months of age, of course that's abnormal. Okay, development. To check development, what we check is developmental milestones. For example, what is developmental milestones? If you will go into the, if you'll get admission in, for example, medical university, what is expected? Like by 1 year of finishing your medical school, you must clear the first professional examination, or your anatomy and physiology exams. In second year, you must pass this. In third year, you must pass this, and fourth year, so on and so forth. So, for example, if you are not passing the exam, you are not achieving the milestones. Okay, you are missing them. So, what happens whenever the babies, they visit the doctors, and the doctors want to make sure that either the babies, they are developing normally or not. So what they check is either the baby is developing normally or not. I will give you more example of this thing. See, I see a baby. He's 1 year of age. He's walking. He's eating well. He can walk well. He can sit. He can talk 2 3 words, and uh, he can follow one step command, or he can understand what I'm saying. He can tell his own name, for example. So I will take it like, okay, he's normal. But for example, if a 1 year old kid came, and if the mother and father are saying that he just babbles, he don't speak any word, he don't walk, even he don't sit without support, you can say. So I will start thinking that at 1 year of age, we expect the babies to do this, but he's not doing this thing. Okay, so that's why this developing the developmental milestones are very important, and we check 4 areas, and this is very important. Believe me, this one is used a lot in clinical medicine. Okay, whenever we are going to examine any baby, uh, again and again, you are going to check the pediatric patients on this basis. The first thing we check is gross motor skills. Okay, gross motor. What is gross motor? Like, you walk, you sit, you run, you turn your head, These are all gross motor skills. Okay. Other thing is called as um, you can see you can say vision, or okay, name it as fine motor and vision. Okay. Remember fine motor, guys. Like, this is the important part, by the way. For example, if you are doing writing something, so that needs some fine motor movements, okay, or fine motor skills to do that. So that's a fine motor skill you are having. Um, for example, uh, you are using your smartphone. You don't need some gross movements, rather you need some fine movements. Okay, so this is the second area we check. Third area is speech and language. Okay. Speech and language, of course, and uh, when you're checking language, of course, most of the babies like the people who cannot speak, by the way, it's not like this that they have some problem with their tongue, rather they cannot hear, by the way. So when you cannot hear, you cannot develop language. So whenever we check speech and language and they are normal, it means hearing is also normal, because of the baby, if he cannot hear anything, of course he cannot speak anything. And the last part is called as social skills. Okay. Social, and of course, like, social includes emotional and behavioral as well. Okay. So we check gross motor, fine motor, speech, and social skills. These are the four areas which you must remember, and we check the patients, not patients, like the babies, on this thing. If they are performing in these things in a good way, that's it. Okay. So uh, I will talk about this thing a little more, and you will understand. You will understand what I'm saying. So these four fields are very important, and it's not like this, like someone who is not developing one skill, we say to their mother and father that, okay, your baby is not normal, not like this. It's a little complicated thing. Of course, we are going to talk in a while. Okay, so uh, for example, at one okay, uh, in the books, by the way, wait, I will show you something. In the books, you are going to find a lot of things, like, I will show you now, and you would know what I'm talking about. You will find a lot of tables. Okay. Talking about what the children can do at this age, at this age, at this age, at this age. And you will find a lot of things, like, at 1 month of age, what is the motor skill, what is the fine motor, this. For example, I will tell you, at 1 month of age, the gross motor skill which the children show is they turn their head side by side when they're supine. The fine motor skill is what, their hands, you will find like fist, like they are always in fighting position, or their hand you will find not open, but they make small fists. Okay. And what is the speech skills at 1 month of age? They cry. And for example, if there is a sudden loud noise, so they startle. uh, like, maybe I know, like, you don't know the meaning of startle or not. This is called a startle reflex. Okay. So what happened, like, they startle. Okay. Whenever they hear anything loud sound, they startle. And what is the social skill they show? If their mothers will come and they will, or the caretaker will come and they are going to pat them, they will keep quiet. Okay. Like this way. So, like, these are the four skills, but at 1 month of age, they are not so important. But I will tell you now a few things which are very important. For example, the gross motor skill, for example, which babies will show at the 6 months of age, is um, they can turn over. They can sit in a tripod position. Tripod, have you seen the camera's tripod? So they can sit with it in a tripod position. Okay. The fine motor skill, they got at this age is like, they can, if you will give them anything, they're going to bring that to their mouth. And uh, uh, at 6 months of age, most babies you will find, like, they babble. Like, what is, there is something called as coos or coo and babble. What is coo? The babies, they started cooing or they make coos by 2 months of age. Like, this is a coo. What is babble? When this sound, ooh, or whatever, they started articulating by the help of their lips, like ba 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 ba, like this. So that is babble. Okay, so coos and babbles. So most of the babies, they start cooing by 2 months of age, but the babies, they start babbling by 6 months of age. And at 6 months of age, the social skill they develop is what? That these are the babies who have some stranger anxiety. Okay. What is stranger anxiety? For example, if there is some stranger in front of them and you will give the baby to the stranger, of course they will start crying. Or simply, as soon as they will see the stranger, they will start crying. Okay. So like these are the skills, they will get at 6 months of age. Um, by 9 months of age, most of the babies, uh, they sit well without support. That's a gross motor. They started showing pincer grip at 9 months. Pincer grip. They can hold the things between their uh, index finger and the thumb. Okay, and the language, uh, they can say the words with two syllabi, like mama baba, like this, and the social skill they show is they can play a peekaboo, like they enjoy peekaboo when you will play with them. The same thing, a 3 months old baby or even a 2 months old baby, they give social smile to their mothers. That's a very important skill we see in the baby. So anyone who is not showing these things, like they're abnormal. So of course, not abnormal, sorry, I'm wrong in this thing. Yeah, like we must examine them more just to see, like, either they are achieving all the developmental milestone, these four areas. So in the books, you are going to find a lot of tables, and of course you'll be confused, like what to remember, what not to remember. But there are a few things which you must remember. I will talk about them in a while. For example, you can see this thing. See, gross motor development at newborn, their limbs are flexed, they are symmetrical posture. If you will pick a newborn like this, there is a head lag. They cannot make their head straight. But at 6 to 8 weeks of age, when you are going to put them in the prone position, see, they raise their head at 45 degrees. At 6 to 8 months of age, at 6 months, they can sit with their round back, but at 8 months, when you will let them sit, their back will be straight. Same thing, you can see 8 to 9 months they started crawling. 10 months they cruise around the furnitures, and 12 months you will found them that most of them they are walking, but unsteady gait with the arms open just to balance them. 15 months, or you will found them like their walking is quite stable. Okay, and this is about fine motor skills. At 6 weeks they follow the moving objects. At 4 months they reaches out of the toys. At 6 months, they have palmar grasp. See, they grasp the things in their palm. 7 months, they transfer the things from one hand to another hand. 10 months, they started showing some mature type of pencil grip. 16 to 18 months, they makes marks with crayons and things like this, okay? And this is hearing and language. At newborn, they startles to loud noise. 3 to 4 months, they do like they coos. 7 months, they turn to soft sounds. 7 to 8 months, they start saying the words like nana, dada, mama, mama, baba, thing like this. And you can see, like, at 12 months what they can do. At 18 months and 20 to 24 months, they use 2 or 3 words. Okay, and same thing with social. At 6 weeks, they smile. They give smile to the caregiver. By the way, they give smile to anyone, because at that time they're not like too much what would be specific with the caregiver. And puts food in mouth, at 6 to 8 months, and wave bye bye. People speak up with 10 to 12 months. 12 months, they can drink from a cup with 2 hands. And these are the things, they can do. Okay, so okay, here are some red flags. Like head control should be achieved as a gross motor within 4 months. Okay, they should sit unsupported by 9 months. They should stand independently by 12 months, and they should walk independently by 18 months. Same things here in fine motor. Fixes and follows visually by 3 months, and like these are the red flags. See, like if these things are not achieved at this age, like you need more investigations, you need more history, you need more. You should dig more. So same thing with hearing and speech. Like anyone who is not saying 3 word sentence by 2.5 years of age, like that's like there's some issue. Okay. And social behavior, if someone is not smiling by 8 weeks of age, okay, but red flag. I will give you simple red flags, guys. Simple red flags to remember. Okay. So that okay, so you have to, this is your homework again, that you have to see uh, from any textbook, these tables, and try to memorize as much as you can. Okay, so one of the red flag for gross motor. Okay, so okay, we should write red flags in red. Okay, the things we must be taken care of. One of the red flag for, you can say, the gross motor red flag. Okay, so anyone who is not walking by 18 months, it's a red flag. Fine motor red flag. You are the doctor and you are checking. Anyone who don't have hand preference by you can say 18 months. Okay. Oh, sorry. Okay. Okay. Speech. Anyone who say less than 10 words at 18 months. And the final thing is social. So anyone not smiling at 3 months, or yes, because we are checking everything in 18 months. Okay, and that's the time we can think of, like, if the baby has some big issues or not. So remember, if the baby is not pointing at 18 months, so these are a few red flags. Okay, for that. So these are developmental milestones, guys. Like most of the babies, by 15 months of age, you will found them that they walk unsupported. Uh, by 1.5 years of age, they usually run, and by 2 years of age, basically, they can go up and downstairs. Okay, but like not like elders, but like with 2 feet per step. Like they will put their right step first on the stair, then the left step on the stair, then right, then left, like on the same stairs. Okay, like we what we do is we go upstairs alternate with alternate feet. Like we put 1 feet on first stair, and the other feet we take and we put it on the next stair. Which kids, they don't do this thing. By 4 years of age, we will found, like most of the kids, they can hop, and 5 years of age, they can ride bicycles. Same thing with fine motor. By 5 years of age, the kids can draw triangles. They can write their names. Regarding speech, they are have very fluent speech. They know what is future tense. They know what is past tense. Okay, they know the alphabets, of course, like of their languages, and the social skill, of course. They become very cooperative. They cooperate with the adults. They obey the things. Not all the kids, of course. Okay, and they understand like what's going on. But at this age, still they don't have the concept of death. But that concept comes around 8 years of 7 to 8 years of age. Like they know, okay, what is death, and death is irreversible, things like this. So like 3 years old kids, they know their sex. Like they know they are a boy or either they are a girl. They know their age, for example. Um, they are not so much sharing at that age, but uh, they can make games, you can say, not like logical games, but you can say silly games. Okay, they can make some silly games or make believe games simply at 3 years of age. So like their language also, like they can combine 3 4 words, and they can make a sentence, and they can recognize colors. They can count sometimes up to 10. Not all the kids, don't expect this thing for every kid, from every kid, but generally that's why, in the textbooks you will find a lot of things which we can check. It's not like this. For example, if in your book it is written that a 2 years of boy can make a tower of 6 cubes, or he can undress himself. So don't expect this thing from every kid. And that's why the textbooks, what they give is a range of things, because not every baby is good in everything. Okay, for example, if a 5-year-old kid can say all the alphabets, okay, so it doesn't mean like all the 5 years old kids can say all the alphabets, or they cannot uh, make uh, like they can remember all. Babies can, but some babies cannot. Like for example, in 5 years old kid, like if you are going to tell them some story, a short story for example, and you will ask them to retell, so they can retell. They can retell at least the sequence of the story. Like if the story starts like this, is that a baby was born and then so on and so forth, so they will keep that sequence. Maybe they will add something, but they will do keep up that sequence. Okay. Like this is how we see. So anyhow, this is your homework as well, that you're going to see, check this developmental milestones from the books, and read as much as you can from that book. Okay. So that's pretty much about what you can say for today's lecture. Okay, YouTube, you can see a few things. For example, YouTube or whatever. Like, I'm not uh, doing the publicity of YouTube, like, but like whatever source you want to use, you can. You have to check like Motor Reflex, what they do, how they do. I have the videos, but I don't want to play the videos over here, which you can do yourself, and wasting some time. Routing, if you will found routing reflex, how they check the routing reflex. Okay. Moro, check the parachute also, check the gallant also, and check the placing also. Check the routing also. Sorry, sucking reflex is very easy, by the way. One more reflex is there. Um, Anyhow, okay, you can check all these reflexes. Okay, from YouTube, and one of the tasks you have to do is to at least go through developmental milestones at least once. Okay. uh, like you will find most of the books, they give in the chart form these things. Okay. So uh, like from birth, the first year of life, the fastest developing field, or the thing which they develop very fast, is gross motor skills. Okay. They are the very, you can say, highlighted or emerging skills they learn in first year of life. The fine motor skill, on the other hand, they start learning around, you can say, 9 months of time to 1.5 years of age. They develop that thing. Okay, and after that, what comes next is speech. Most of the kids, they started like most of the kids, when you will find them that like 1 year of age, or 13, 14, 15 months of age, you will find that they don't say anything. They just keep quiet. They just cry, they just shout, they just scream, but they don't talk. Like, they don't make some sensible speech. So after 1.5 years of life, they started developing this until 3 years of age, you can say. And the social skills, by the way, especially social skills, they start learning after 2 years of life. Okay. and then they start keep on developing for the rest of life, of course. Okay, so guys, that's all for today, and next lecture will be about nutrition, and hope all of you have enjoyed this lecture. Thank you so